With Americans waiting for their turn to get the COVID-19 vaccine, many healthcare workers have already been inoculated. A Bay County doctor has experienced both the illness and the vaccine. News 13's Madeline Bierster spoke with him and shares his story.
We're going to need to get as close to 67% of the world's population vaccinated, either through having the disease already and living or vaccinated. That's 5.2 billion people.
Dr. Frank Merritt, an emergency room doctor at Ascension Sacred Heart Bay, contracted COVID-19 back in July. His primary care physician prescribed medicine ahead of his formal diagnosis.
That starting of medicine still is probably the single best thing you can do, is to start before you even get results back. If you and your doctor can do that, and that probably saved my life.
He says it's a disease that doesn't discriminate and affects everyone in a different way.
My first 3 days were really kind of like having the flu. I thought, well, it's not a big deal, you know. And I actually got better for about 2 days. But then I went into a second phase, which was worse, got better for a day or two, and then went into a third phase in the third week, which was the worst. And about 3 of those 7 days had the real severe shortness of breath.
Dr. Merritt received the Moderna vaccine last week and got serious symptoms again.
The first 10 hours I felt great. I was able to play with my family outside. I thought nothing of it. And then at the 10-hour mark, had a very bad result. Horrible fever, chills, muscle aches, which are myalgias, arthralgias, bony aches, and to the point that those reactions were far worse than what I felt when I had COVID.
Dr. Merritt encourages everyone to talk to their doctor about what's best for them.
People that have had COVID, at least moderate to severe COVID, probably do really need to wonder if they need the full dose on the first time and if they need the second booster dose, since we've already once again had our primer dose by having the disease.
Many questions about the long-term effects of the virus remain unanswered. He says there is evidence to show asymptomatic college athletes are experiencing severe long-term effects.
At the 3-month mark, over 60% of them had some type of myocarditis, which is inflammation of the heart, and about 42% of them had pulmonary fibrosis, which is, the scarring down of the lungs.
But Dr. Merritt still stands by his recommendation to get the vaccine if you can. In Bay County, Madeline Bierster, News 13, Panhandle Strong.